Now we're on arthritis. Before I go into exercise prescription, I'll talk about the two kinds of arthritis, rheumatoid and osteoarthritis. The difference between them involves one being structural and one being related to our nervous system. Both involve joint pain. Now, osteoarthritis is the most common form. What we know about is the degeneration of the cartilage in our bones that are within a joint. So that is associated with feelings of stiffness, pain, grinding. There is a lack of synovial fluid. If you remember from anatomy, synovial fluid is a lubricant for the joint. And so movement actually stimulates the secretion of synovial fluid to help joint motion move easier. Now, rheumatoid arthritis is an autoimmune disease. And what that does is a lot of the feelings that you have that come with osteoarthritis, you experience with rheumatoid. You feel like your joints are inflamed, and they refer to it as inflammation. And there'll be a redness, a heat, but what it is just the nerves in those areas sending impulses of pain back to your brain. There's no damage that's actually that's caused to create that pain. It's the nerve impulses. However, when you do have a flare-up, that's something you need to be aware of as a sufferer of rheumatoid arthritis or a trainer, that exercise should not persist during that. Now, when it comes to arthritis and exercise, we've got there are some differences associated with the two different types. So we want low impact, non-impact, things that are going to be easier to move through. So land exercise isn't always great, especially if you're talking about someone whose weight puts them in a more obese category. They're moving around more mass, that's more pressure that's on those joints, so getting them in the water can lessen the feeling of their mass. So low impact exercises, slow moving exercises, low intensity, moving, dynamic exercises that flow through different poses, different moves. Regular exercise, at least 3, if not more than that, is helpful because you're moving the joints, and any movement of the body, warming of the body, getting the synovial fluid flowing through the joints will make daily activities better. So you want to think about certain areas of the body as well to not focus on. You don't want to do a lot of wrist and knee movement because those are more sensitive areas to the different forms of arthritis. And obviously, just like with osteoporosis, you don't want to focus on anything jarring, ballistic, jumpy. I'm going to move on to children. And most importantly with kids, you want to make this fun and positive. Kids are kids for a reason. Adults want to have fun. So you could apply this to adults, but don't take the prescription that way. Kids need at least 60 minutes accumulated of exercise. That doesn't mean 60 continuous minutes, 60 accumulated minutes most days or all days if possible of the week. Now this changes as kids age. Their ability to complete larger chunks of exercise at once changes as they learn how to pace themselves. With regards to strength activity, that's something you really kind of want to avoid because too heavy of weights can affect the growth process. Also, as children are playing, you want to avoid vigorous activity. You want to avoid contact. You want to avoid anything that could inhibit the growth process. Also, a child's attention span is not the same as ours. So you may be able to sit and listen to me talk forever, but they sure can't. So don't expect the same with exercise. They're very good at stop and go and rest. And so when designing a program for kids, you want to build it around those three principles. You can do exercises that challenge the child's strength, but you want to rely on body weight exercises. And always, like I mentioned from the beginning, make sure that it's fun and involved. So here are aerobic guidelines for kids. You want to choose short burst activities that require a lot of energy. They have a lot, so use it. They'll find more. Encourage activities that require a lot of movement, big muscle groups, and make sure they stay well hydrated. Children have they're not as in tune with their bodies, so they're not aware of heating and cooling or thirst. When it comes to strength training, you should not allow children to use free weights until they can understand, learn, and replicate proper lifting technique. Most exercise equipment, remember, is designed for an adult. It is designed for an adult-sized body. So anatomically, the pivot points will not line up. It is not made for children. And bands, tubing, balls, things like that already look fun because they're bright and colorful, and those can be great tools to use for strength training with kids. Next is obesity. Obesity is something that tends to be a risk factor for a lot of stuff, and exercise is something that can easily help remedy and reverse a lot of these risk factors. You can read them yourself. They're in your manual, and you can see as many bad things, you have as many good things that exercise can help with. And typically they line up with each bad thing over there, something on the good side will help to reverse it. So with an obese person, you have to remember there's going to be a difference in center of gravity, and that daily activities are challenging in themselves. Getting up out of a chair, getting in and out of a car. They're trying to move a greater mass than what their body was designed to move. So just everything they do in life is a challenge, more so than it is for you. So because of the varying disease states that are associated with obesity, you want to make sure that they have consulted a physician, that you have their consent, that you know of other disease states, that you know of any musculoskeletal injuries that they could already have. You want to start slowly, and you want to set realistic goals. Because you are talking about a weight challenge, there could be some arthritis involved. Warming up and cooling down, again, extremely important. Exercise prescription for obesity, low intensity, assuming that this person is coming to you sedentary. Now, their doctor, a cardiologist, could have a specific amount that they want them to work at. You can figure that out. But as a rule of thumb, you want to start low and increase to 60%, so a more moderate intensity level as soon as possible. 3 to 7 days is what's recommended. With the beginner, you want to make sure you progress slowly. And if you remember from cardiovascular training, when we did program design, we came up with different phases of conditioning, and we have them improving, changing frequency, changing the time, changing the intensity. And with someone with an obese client, the better you can get them into cardiovascular health, they will see results drastically quicker than if you try and just progress slowly. So getting them up to being able to work at 60%, they will see greater decline in heart disease, diabetes, and blood pressure.